Go right ahead.
Hi, my name is Alma, and I am with the Indiana Institute for Behavior Analysis, or TIBA for short. We do ABA therapy with kids with autism. We do take them as young as 18 months and as old as 26 years old, or as long as they're able to keep coverage. We do work here Monday through Friday, 8:15 to 4:15. It's like a school for our kids. So we do work one-on-one. For every client that we have one therapist. And our therapists are in charge of running daily programs with our kiddos. It depends on their skill levels. Some of our kids might be verbal, nonverbal, aggressive, non-aggressive. So depending on their skill levels, it's what those programs are based on. So our BCABAs and BCBAs, they are the ones in charge of creating the programs for our kids. And our therapists are the ones in charge of running those programs on a daily basis. It can be anything from daily living skills like brushing their teeth, brushing their hair, washing their hands, changing their clothes, or it can be anything related to school. Learning their ABCs, their numbers, their colors, or just the difference between hot and cold, big and small. Our kids, because they are all on the spectrum, they do learn different. They learn by repetition. So we want to make sure that we are running those targets on a daily basis. We want to make sure that they are able to retain the information and apply it to different scenarios. We want to know that whatever they are learning here, they're able to go home and apply those skills whenever they leave the center.
Wonderful. It sounds like you do very rewarding and meaningful work there.
Yeah, thank you. It actually is very meaningful. I used to be a therapist before I came into HR, and it's highly rewarding whenever you started with a kid who couldn't tie their shoes, and now they're tying your shoes even, or whenever we had a kid who's nonverbal and it's kind of just pointing at things to communicate. And then now, a couple months later, they're able to man for water or more please, or just different things that they're able to actually do and communicate with you.
That is wonderful. I know in your description you mentioned a couple of the roles of a therapist, and then a couple of the other roles. I know you talked about them in the acronym. Could you kind of maybe further elucidate on what those roles are and how they
Yeah.
assist the therapist?
Yes. So the BCABAs, those are board certified assistance behavior analysts. So they are at a bachelor's degree level. So if our students have a bachelor's degree, they do have to go and add a couple more classes and clear an exam in order to become a BCABA. A BCBA is at a master's level. So they can do pretty much the same, with the exception of the BCABA at the bachelor's level. They still need supervision from a BCBA. A BCBA is able to, work daily without any supervision. I believe their license have to be renewed every 5 years. They have to be able to keep everything in place, keep their licensings, make sure that they're not in trouble or anything like that.
What about with these roles? I know you said bachelor's level. If a student is in the process of completing their bachelor's degree, would they be eligible for these type of roles?
So we do have clinical students. So our clinical students are the ones between our therapists and our BCABAs or BCBAs. So we do have a 6 month waiting period here. So, when they get higher on, the entry level position would be a technician, BT.
Okay.
After 6 months, if they want to become a BCABA or BCBA, they can, let us know, and then they'll be we'll have an evaluation with them, and kind of let them know, what the guidelines are and everything. At that point, they become a clinical assistant, and they are able to, one, do therapy, but they're also learning to program. They're also learning to do everything else that the BCABS and BCBAs do.
Wonderful. So that sounds like kind of how one would go about career progression in your organization. Is that correct? Starting kind
That
of
is
as a
correct.
potentially starting as a technician for someone that doesn't already have a bachelor's degree.
Yes.
Okay.
So the entry level position is a BT, behavior technician.
Mhm.
After that, we do train them to become an RBT, a registered behavior technician. It's a 2 week training, and we do want them to become registered within the first 45 days of working with us.
Sure.
Once they're registered, that would be like the second level position that we have here. Then it would be clinical assistants, and then BCABA or BCBA if they decide to go back to college.
Okay. Great. So you did mention that your therapists work with the same client, the child, the same one the whole time. Is that correct?
So yeah, so they do have 2 clients per day. They have one from 8:30 to 12:30, and the second one from 12:30 to 4 o'clock. We do try to keep our therapists for the same 3 to 5 clients for a period of 3 to 5 months. After that, we do rotate clients just so that everyone gets to know everyone's programs,
Sure.
because our clients, they have to be able to tolerate that change, and we have to introduce it to them, a little bit at a time.
Sure. I understand. That sounds like they get great individualized long-term attention. So this isn't just an appointment that's an hour long. They're with them for.
Correct. Yes. So this is kind of it's a therapy center, but it looks a lot like a school, like a daycare environment. So
Mhm.
you will be with your client the whole day. A lot of our clients don't go to school. We are their school.
I see.
Um, Unfortunately, autism is not something that can be cured, but it's something that, with the right intervention at the right time, you can teach them the right skills in order to survive in
Sure.
life, pretty much.
Wonderful. Love that. Yeah. As you're looking to hire those folks in those positions that you described, what are some of that beyond the credentialing, right? The degree and the credentials that they've earned through various training programs and so forth. What are some of the key attributes and characteristics that you're looking for in your employees there at Tibia?
Yes, so we want to make sure that they are patient. Like I said, our kids, they are not like every other kid who may learn something very quickly. They do learn by repetition. So you may be working on the same task for 3 months before a child can actually master those skills. So they definitely have to be patient, compassionate, um, but very outgoing. Yes, our kids are special. They do have special needs, but they're still kids, so they want to run around, play with you. They want to play hide and seek. They want to go out for walks. And we do have our back area. It's like a small gym. So you have to be able to get down to their level. You may be working with a little one who wants to pretend to be dogs. So we want you to get on the floor and act like a dog with them. Run after them, play ball, catch, basketball. You have to be very creative, um, and outgoing in order to follow their lead. So that's the way that we teach here. We follow our kids' lead. Um, yeah, just be able to be a child,
I think
be a
going
child
to
again.
work and pretending, playing like one's a dog, I think that sounds like a great day. That sounds like a lot of fun.
Yes, that's the thing about here. I mean, yes, you're working with your client, but your client gets a reinforcement time every, depending on their program. It could be every 30 minutes. It could be every 30 tasks, every 2 minutes. So that break that the clients have, it's a break for you as well. So you are playing with them as well. You don't have to be at the table, teaching them their ABCs or their colors or whatever you're working on. It's a chance for you and for them and for your client to be silly and have some fun.
Sounds great. So can you talk a little bit about kind of where you're located, or if you have multiple locations and that type of thing?
Yes, so we are located off of Michigan Road and 86th Street, right by the pyramids, the Pearson Pyramids. That's our first location. Our second location is up in Evansville. That would be downtown Evansville, and that one has been open since fall 2020. We are hiring more techs because we do have a third location coming up on the east side of the city, right off of Post Road and Bennington Pike.
Okay.
Um, Hopefully, we'll be able to have that third center running by May.
So sounds like a lot of expansion, growth, and therefore opportunities.
Yes, right now we are hiring for those techs, BCABAs and BCBAs, but as
Mhm.
we expand, we will be hiring for, office admin and office manager, all of those different roles.
Wonderful. That's great. What is something that maybe someone wouldn't expect about your organization, or something that you really are proud of in terms of your culture at Tibia, in terms of working there? Something you really enjoy about working there?
Yeah, so we are actually a faith-based organization. So we won't ask you to pray with us. We respect everyone's backgrounds and beliefs, but that just means that the way that we treat our clients, their families and our staff, is always with the best quality, the best treatment that we can give. We are also African American owned, and that's huge. We are not one, but we're among the very few ABA centers who are owned by African Americans. And we are very, very diverse. Our staff, we have Hispanics, African Americans, white, we have some people from India. So we do have a lot of different ethnicities here, just because we know that our kids come from different backgrounds and ethnicities as well. So we want to make sure that we are representing everyone. Um, Part of our holidays, paid holidays here, we do have Juneteenth, which is Freedom Day. And we also, of course, we have the 4th of July, and then we also have a Hispanic Heritage Observance Day. So, we do try to represent everyone out
Nice.
there. And, we're only getting bigger. So I know that we will represent a lot more people.
Wonderful. It sounds like you absolutely embody your diversity, equity, and inclusion piece. It's not a policy, it is who you are. That's
That's who we
wonderful.
are.
That's who you are. That's
Yeah.
wonderful. Great. Just one other question about, you mentioned, students potentially working, before they get their degree. Do you have any specific internship programs, or does that come through the clinicals?
We do have internship programs, especially over the summer. We want to make sure that we retain our talent. We want to make sure that whoever we hire or will stay with us for long term, just because we
Sure.
really do value our talent. So yes, we do have those opportunities. As well as, we do have therapists who came for a summer internship, and once they
Mhm.
were done with school, they applied and they were hired on.
Wonderful. So, what would a student or an alumni that's watching this, what steps would they take if they were interested? They wanted to find out more, they wanted to speak with you perhaps, or just understand a little bit more about Tibia, or I know site visits are not quite as easy to do right now, but at least learn a little bit more maybe about the positions. What would a good next step be?
Yeah, they can, look us up on Facebook. They can also look at our website, that is www.teba.org. So that's TIIBA.org. They can go ahead and apply on there, or they can email me. It's alma@teba.org. That's ALMA @TIIBA.org. And I'll be happy to explain the different positions that we have, what we do, who we are, and with an appointment we can always bring them in for a tour, just to see if this is something that they might be interested in.
Sure. That sounds wonderful. Sounds like a great organization. Is there anything that we didn't cover that you'd like to make sure that those watching would know about TIBA?
Yes, so we are hiring for an SLP, speech language pathologist. I know we are short in Indiana,
Mhm.
but this is a great opportunity. We do have one SLP in Evansville, so she is the one providing supervision if we have any students there who are not quite ready to take on a role alone. So we do have those supervision opportunities as well. It's great benefits, and it's really rewarding to work as part of the Teba family.
Wonderful. What a great organization. I thank you for your time today to help spread the word. And we will ensure that we post this on social media and make sure that there is access for our students to see this.
Awesome. Thank you so much for meeting with me,
All right.
and I hope to see a lot of your students coming in.
Students and alumni. Yes, absolutely. We'll try and get the word out at Marion.
Thank you.
Thanks so much. Have a wonderful day.
You too.
All right.